right, Mr. John, I'm going to pull this curtain real fast so we can have a little more privacy. All right, Mr. John, my name's Shanae and I'm one of the nursing students. I've also brought along some of my other nursing student friends. They're going to introduce themselves to you.
My name is Ashley. I'm a nursing student as well.
And my name is Rebecca, and I'm another one of your nursing students today.
All right, Mr. John, we're actually here just to empty your Foley bag for you. We want to make sure that everything's okay before we do so. And you would verify with your patient that they're okay, that they're comfortable with you emptying their Foley bag, and that everything's all right with them before we begin. And now we're actually we would come in with our hands washed, and now we're gonna put on some hand sanitizer just to make sure our hands are really clean. And then we'll also all put on some gloves just in case we come in contact with any of the urine. If you're worried about getting any of the urine on you or anything like that, you would wear a gown and some goggles if you're worried about it splashing in your eyes or anything. And then after you have your gloves on, you want to make sure you have a pad laid out. So in case any of the urine spills from the bag, because it can get a little messy just because it falls by gravity, you want to make sure you have a cylinder that's granulated that has the ml so we can measure our output of our patient's urine. And these are all the things that are very essential to have before we begin. And now my friend Rebecca is going to tell you how to actually get them.
After we've put our mat down and we have our cylinder, we want to look at the Foley bag, and we are going to make sure that this metal clip is in place, so that when we unclip our tube from the Foley bag, it doesn't spray everywhere. So I've checked that it's clipped. I'm going to unclip this green piece. And now, very carefully, I'm going to hold it over the cylinder, and I'm going to open this metal clip very slowly and steadily so that it doesn't splash up at me or out of the cylinder. And for the purpose of this, I'm just going to empty a little bit of urine, but normally you would empty the entire Foley bag and then measure the patient's urine in the cylinder. So I'm going to unclip very slowly. Okay, and I'm going to put it back and make sure it's in place. And now I'm just going to put this back in here.
Okay, so after you've collected the urine, you want to see exactly how much is in your graduated cylinder in milliliters, and you would want to record that in the patient's chart. And this is important because when you have a patient that has a catheter or any kind of feeding tubes, you want to measure their input and output for a fluid deficit or anything like that. And sometimes this will be flushed in the toilet. Maybe it needs to be sent to lab. If it were to be sent to lab, you would put it in the appropriate container, and you would want to put the patient's name, date of birth, and your initials as well onto the container that it's being sent to lab in, as well as putting it in a biohazard bag. And then we would leave our patient. Thank you, Mr. Smith, for your time, and that's it.